Module name: Technologies in Health Supply Chain Systems. Session 2: Technologies for Forecasting and Supply Planning in Health Supply Chain. Greeting learner and welcome to Session 1. Before we get started on the topics, let's introduce the session. This session introduces the major technologies used for forecasting and supply planning in Ethiopia, explains how they work, and highlights their applications, benefits, and challenges. To successfully complete this session, you must cover all of the content, interactions, or engagements and questions provided. Please be advised that there are interactivities and questions that require your participation, as well as instructions on how to complete the theses. Please carefully follow the instructions to complete the interactions and questions. The session takes approximately 30 minutes to complete. After completing session, you will be able to explain the role of digital technologies in forecasting and supply planning. Discuss key digital systems commonly used for forecasting and supply planning in health supply chain in Ethiopia. Describe emerging technologies used in forecasting and supply planning. Forecasting is the process of estimating future demand for health commodities based on historical consumption, morbidity patterns, demographic changes, and program targets. Supply planning, on the other hand, ensures that procurement, distribution, and inventory management align with these forecasts to maintain optimal stock levels. Effective forecasting and supply planning helps to prevent stockouts of life-saving commodities, example, antiretrovirals, anti-malaria medicines. Avoid overstocking and wastage of short shelf life items, for example, vaccines. Optimize procurement cycles and reduce emergency orders. Improve budget utilization and minimize supply chain disruptions. In Ethiopia, fluctuating demand, infrastructure constraints, and supply interruptions have challenged these processes, and technology supports solutions by improving data quality, visibility, and responsiveness. What do you think is the role of technology in forecasting and supply planning? Digital systems strengthen forecasting and supply planning by improving the accuracy and completeness of data, automating calculations and trend analyses, integrating information across facilities, regions, and national warehouses, providing real-time visibility of stock levels and consumption patterns, supporting rapid adjustments during outbreaks or emergencies, enabling evidence-based decision-making at all levels. As Ethiopia advances toward a more digitized supply chain, these technologies have become indispensable. List the technologies you currently know that are used for forecasting and supply planning. Ethiopia's health supply chain has adopted several digital tools to strengthen forecasting and supply planning. Many digital technologies are implemented with support from international partners. These tools include a range of information systems and advanced analytics platforms, and support quantification during data collection and validation and forecasting and supply planning phases. Reliable data is the starting point for accurate forecasting. In Ethiopia, planners use two main types of data: consumption data that reflects what was actually dispensed or used, and morbidity data, which reflects disease burden and used when consumption data is incomplete or stockouts occurred. Technologies that generate or support these data are often called feeder systems and are essential before applying forecasting tools. Dagu 2.0 is a locally developed stock management tool for health facilities. It also plays a key role in forecasting by generating the ARF electronically. EAPTS is a pharmacy-level system used at dispensing units. It supports forecasting by providing clean consumption data and tracking patient service patterns that influence demand. VITAS is the ERP system used at epicentral and hub levels. It provides issues to facilities data, which can be used as a proxy for consumption. DHIS2 is the National Health Information Platform for reporting service delivery and IPLS indicators. It strengthens integration between logistics data and health service data. The function of each digital tool will be discussed in detail under other health supply chain functions in the upcoming sessions. The Quantification Analytics Tool, or QAT, is a modern and integrated platform designed to support country-led supply planning. It was developed by the USAID Global Health Supply Chain Program. QAT enhances older forecasting tools by offering advanced scenario planning, improved logic, and the ability to work offline. In Ethiopia, the Ministry of Health and its partners use QAT to forecast and plan the supply needs of several health programs, including commodities for tuberculosis and malaria. Quantimed helps calculate medicine and supply needs for health programs. IT supports order planning and budgeting using consumption, morbidity, or proxy consumption methods. The tool can be applied at facility, program, or national levels, allows scaling of morbidity-based estimates, and supports data collection, reporting, and economic assessments of medicine use. Pipeline was another standalone legacy tool used for supply planning. Similar to Quantimed, its features are now incorporated into the integrated QAT platform. The tool is used to track commodity shipments, monitors quantities, shipping dates, and expected arrival, and supports updates to national supply plans. This is a simple Ministry of Health tool used to quantify pharmaceuticals at health facilities. It estimates forecast and procurement needs using a consumption-based method. The tool considers factors such as stock on hand, stock on order, wastage, and buffer stock. It then calculates the required quantities and values for each product. This helps facilities plan their annual procurement budgets for essential medicines and supports communication and justification of budget needs to decision-makers. Artificial intelligence and machine learning improve demand forecasting by analyzing large datasets. They can predict disease-related commodity needs using weather and epidemiological data, anticipate seasonal spikes such as malaria, and strengthen long-term supply planning. Currently, there is no specific, widely implemented national pharmaceutical quantification tool in Ethiopia that uses emerging technologies such as artificial intelligence. Summary: digital technologies improve data accuracy, automate analyses, and provide real-time visibility, enabling timely and evidence-based supply decisions. Tools like QAT, Quantimed, pipeline monitoring, and the National Pharmaceutical Tool collect and analyze data to support accurate forecasting and supply planning. AI, machine learning, IoT, and control tower dashboards enhance predictive forecasting, end-to-end visibility, and supply chain resilience.